This episode of eHealth Radio is brought to you by uNatural, empowering your health for those who burn the candle at both ends. Vitality combines potent super ingredients like zinc, ashwagandha, and holy basil to provide adrenal support, manage cortisol, fight fatigue, relieve stress, and maintain focused energy. Order now on uNatural.com, risk-free for 90 days. Again, that is eUNatural.com.
This is the eHealth Radio Network, your source for health advice on demand. And now your host, Eric Michaels.
Thanks for joining us once again here on the eHealth Radio Network. This is your host, Eric Michaels. eHealth Radio gives you the most current health information, news, and advice featuring some of the leading innovators in healthcare and wellness who are changing healthcare as we know it. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. Today we're speaking with Mr. Ethan Davidoff, the CEO and founder of Atlas Heath, the leader in philanthropic reimbursement that empowers health systems with an end-to-end solution for enrolling patients in medical financial aid programs. Mr. Davidoff, thanks for joining us here today on eHealth Radio.
Thanks for having me, Eric.
It's certainly our pleasure. Thanks for coming out today. So tell our audience about Atlas Heath, its goals, and who it serves. Let's start there.
Absolutely. So we partner with health systems to help them reduce uncompensated care by providing technology and services that help their patients enroll in medical financial aid programs. That's what we do.
And definitely a need in the space for sure on that. Now tell us about the Navigator 4.0 and the services and benefits it will provide to health systems and its users as well.
So Navigator 4.0 is a recent product launch, or product upgrade rather, where we've layered in artificial intelligence that looks specifically within the EMR at specific charges and transactions at the claims level to determine with accuracy what specific charges are going to be eligible for reimbursement from over 3,000 different philanthropic programs. And so our system predicts the exact projected reimbursement amount from these programs. It creates optimized work lists. It contains confidence scores for the enrollment probabilities, and is a big upgrade to ensure that no patient is left behind and that health systems can truly optimize the reimbursement from these philanthropies.
Yeah, I certainly appreciate the input on that. That is helpful. Now, what are your relationships with healthcare payers and philanthropic relief programs designated to help aid hospital systems during especially the COVID-19 pandemic?
So we work very closely with these payers and relief programs. And so part of our service involves our own patient advocates that become an augmentation of a health system's existing financial aid department. And so we're working very closely with the programs and the payers to kind of work through any challenges or issues regarding enrollment, as well as claims and reimbursement. And so it's a very symbiotic relationship.
And we're certainly appreciative of what Atlas Heath is doing, especially during these difficult times in those regards. Now, let's get back to Navigator 4.0. What benefits can Navigator 4.0 offer to 340B hospital systems who are experiencing the significant rate cuts during these unprecedented times?
So with the 340B rate cuts, what's happened is certain procedures and have become harder and harder for a hospital or a health system to break even based on the reimbursement amount versus the cost to acquire and deliver the drug. And so the programs that we work with, specifically the portion that do patient assistance, are really kind of a lifeline, helping health systems basically make the right policy decisions to ensure that they can deliver the care that's needed to the patient, but also make sure at minimum they're breaking even. They can keep the lights on.
Certainly appreciate all the details and information shared so far. Now, here's what your adrenal system needs: zinc, ashwagandha, holy basil, and rhodiola. What it doesn't need is another cup of coffee. Get natural support at unatural.com. Take 15% off of our 100% pure formula with eHealth 15 at checkout on unatural.com. That's eHealth 15 at eunatural.com. Today we're speaking with Mr. Ethan Davidoff, the CEO and founder of Atlas Heath, the leader in philanthropic reimbursement that empowers health systems with an end-to-end solution for enrolling patients in medical financial aid programs. He's joined us here today on eHealth Radio's Health News and Healthcare channels, a part of the eHealth Radio Network. Now, Mr. Davidoff, are there any financial risks to employers or hospital systems may be facing right now that Navigator 4.0 is working to solve?
Absolutely. So, during these times with drastic changes in volumes and the rising unemployment due to the fallout from COVID, less people have coverage or kind of the money stored away to pay an out-of-pocket balance. And so because Navigator 4.0 has the most comprehensive set of medical financial aid programs available, we're basically delivering revenue and cash flow to these health systems to offset these financial risks from the fallout from COVID.
Everything I'm hearing, it certainly sounds like you're making quite an impact in the space, and we're thankful for that. Now, hospital systems are desperate for any kind of aid during the COVID-19 pandemic. What other ways can your services provide relief for hospitals struggling with financial pressures?
So by providing enrollment services with our patient advocates, what we're doing is relieving the burden of a health system needing to hire more kind of in-house staff. So we're kind of relieving the pressure from their OpEx budgets. And our model is to work on performance. And so we take on the financial risk to stand up the business and augment the existing financial aid department to go and help capture this aid and this revenue lift. So that's definitely a key benefit. And other than that, I'd say there's kind of an important piece of this around patient satisfaction, patient experience, as well as cost savings from the operational efficiencies that come from the technology components that automate and streamline what's to date been a very laborious process.
Yes, for sure on that. Now, another question for you. How can patients who have lost their jobs and health insurance due to the COVID-19 economic crisis benefit from Atlas Navigator 4.0 in terms of longevity?
So for patients that have lost their job or lost their health insurance coverage, one of our services provides assistance with premiums. We've partnered with 501c3 nonprofit foundations, and that based on a patient's specific situation with the effects of COVID-19, they may be eligible to receive assistance with their premiums. And so that is a really powerful opportunity to help patients in this time of need. Moreover, for the core set of philanthropic programs that we work with, these programs can help provide funding to patients for years. So it's not only a kind of one-off relief on a specific bill, but it can be relief for any recurring treatments and recurring procedures that the patient might have.
Excellent. Excellent. That is certainly some good news. Now, does Atlas Navigator 4.0 plan on providing relief for urgent care or walk-in clinics that receive patients for COVID-19 testing or intervention?
So we do, from the perspective that part of Navigator 4.0 has a technology matching component that connects specific COVID-19 related visits to the $2 billion federal program for CARES relief. So the provider ultimately has to submit the claim for reimbursement through the HRSA portal. However, a component of Navigator 4.0 automates the matching of which specific walk-ins and visits and tests are going to be eligible for government reimbursement. So this helps both the patient to encourage them if they're sick and they think they might have COVID to get tested, knowing that they're not going to have an out-of-pocket balance, while also helping the provider by knowing that they're going to be reimbursed for the patients that walk in that are eligible for relief from this program.
Also, COVID-19 patients often also experience other related illnesses. What other ways can your service provide treatment and ensure patients will be financially and medically protected?
So the core set of programs we work with are set up for patients with chronic conditions, rare diseases, and other comorbidities. And so the most of the programs are kind of perfectly set up for patients that are experiencing a multitude of illnesses. The way that the benefit or ensuring that they can, be financially sound kind of fits into the core model of Navigator 4.0. So if a patient is receiving treatment from one of our health system partners, we're going to exhaust every avenue to find medical financial aid to help the patient.
And once again, we certainly appreciate what you're doing in the space and making an impact. Lastly, and obviously one last question, how have you been trying to educate underserved populations on your services? And if you would describe how Atlas Navigator 4.0 will help with the challenges for underserved populations with access to primary care services. Let's wrap things up with that today.
That's a great question, Eric. We believe there is a large opportunity to kind of educate patients and consumers across this country that there is medical financial aid available. Much of the aid does not get utilized because patients assume they can't afford health care or assume that there's no program out there that will help them. So we are starting a few different initiatives to really take an approach to bring more transparency to the market, to get more information out there on the internet, and do our part to, bring light to these fantastic programs that we work with, to help patients across the country.
Well, I'm sure after hearing all this information, listeners want to know how they can tap into Atlas Health and get further details as well. Where's the best place online to get more information?
www.atlas.health.
And that's about as easy as it gets. Again, Mr. Davidoff, all the best. Keep doing what you're doing, and thanks so much for joining us here today on eHealth Radio.
Thanks so much, Eric. Take care.
And you're more than welcome, and you too. We've been speaking with Mr. Ethan Davidoff, the CEO and founder of Atlas Health, the leader in philanthropic reimbursement that empowers health systems with an end-to-end solution for enrolling patients in medical financial aid programs. And for all the details and to learn more, visit atlas.health. And again, this has been your host, Eric Michaels, and we do thank you for your continued support of the eHealth Radio Network. Join us again soon for another episode that will help further expand your knowledge on those things that are important to your health and wellness. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. And as always, we do thank you for tuning in.
Thanks for tuning in to the eHealth Radio Network. For more information or to subscribe to this podcast, visit eHealthRadioNetwork.com.
This episode of eHealth Radio was brought to you by UNatural, empowering your health for those who burn the candle at both ends. Vitality combines potent super ingredients like zinc, ashwagandha, and holy basil to provide adrenal support, manage cortisol, fight fatigue, relieve stress, and maintain focused energy. Order now on eunatural.com, risk-free for 90 days. Again, that's eunatural.com.